Omicron may be less severe, on average, of course, but the narrative that it is mild disease is misleading, hurts the overall response, and costs more lives. Make no mistake, Omicron is causing hospitalizations and deaths, and even the less severe cases are inundating health facilities. The virus is circulating far too intensely, with many still vulnerable. For many countries, the next few weeks remain really critical for health workers and health systems. I urge everyone to do their best to reduce risk of infection so that you can help take pressure off the system. Now is not the time to give up and wave the white flag. We can still significantly reduce the impact of the current wave by sharing and using health tools effectively and implementing public health and social measures that we know work. Vaccines may be less effective at preventing infection and transmission of Omicron than they were for previous variants, but they still are exceptionally good at preventing serious disease and death. This pandemic is nowhere near over, and with the incredible growth of Omicron globally, new variants are likely to emerge, which is why tracking and assessment remain critical.
Across all of the vaccines, high levels of protection against severe disease. That's the outcome we're most interested in, protection against death. Against Omicron, many of the vaccines have shown a reduction in efficacy against infection. And that's why we see a lot of breakthrough infections, but these are mostly not resulting in severe disease. So that's a positive. There is some waning which occurs over a period of time. And we've seen that there's a slight drop in the protection, again, mostly against infection, but also a little bit against the severe disease. And we need more of those studies. We need to follow this out. And that is why we've said, putting all of this together, the aim is to protect the most vulnerable, to protect those at highest risk of severe disease and dying. Those are our elderly populations, the immunocompromised, people with underlying conditions, but also healthcare workers, because if a lot of healthcare workers get infected, as we see now, they can be out sick, and we don't want them getting severely ill. So to reserve boosters for that population. There's no evidence right now that healthy children or healthy adolescents need boosters, no evidence at all.